Ladies and gentlemen, if I can please issue a call to order. My event manager, Michael Wasserman, told me to do it, and when Michael said, I do it. I would very much appreciate if everyone could please take seats. I think I left it somewhere in there. Yeah. If I can please ask Senator Brewer, Representative Kulik, Senator Donnelly, and leaders of advocacy group right here with me on my side at the podium, I would appreciate that. Hal, Alan, Tom, Kevin. Ladies and gentlemen, I would like to thank you for your participation in the 4th Annual Prostate Cancer Awareness Day at the Massachusetts State House. Welcome. It's a great pleasure for me to introduce David Brown. Many of you know David Brown as anchor and reporter for ABC TV News Center 5. David, please join me at the podium. This annual event was created in 2009 with the goal of recognizing prostate cancer as a priority in public health and a major disparity in patient care, and framing the need for advanced diagnosis and treatment of prostate cancer. I am looking at the gathering today, and I'm thinking about my friend Beth Broderick, a Hollywood celebrity and a champion, original pioneer of the AIDS and breast cancer movements. Many of us watched over the last 3 decades how these two movements, breast and AIDS, assured national attention, national investment in research, and transformed prevention and treatment of these dreadful diseases. For Beth, our event in 2009 was the first one in prostate cancer, and she joined us largely because we helped her recognize that prostate cancer crisis is just as big as that of AIDS and breast cancer. She walked into our first event, looked at 50, 60 people present, and was stunned how much different it was compared to thousands of people she sees at the breast cancer and AIDS rallies. However, by the end of the day, she told me that she recognized that a small group of people committed to prostate cancer awareness she had observed that day reminded her of a small group of people who 3 decades ago initiated the beginning of the AIDS and breast cancer movement, a small group of pioneers. I'd like to introduce to you people who are standing next to me. It's a small core group of extraordinary individuals who have been lending their vision, commitment, and passion to creating a model of national leadership in prostate cancer awareness. Senator Stephen Brewer is probably right now voting for an important Massachusetts delegation, important Massachusetts legislation, and his staff member, Megan Kelly, Representative Stephen Kulik, Vice Chair of Joint Committee on Ways and Means, and his key staff member, Sean Connolly, Senator Kenneth Donnelly, probably is also somewhere alongside of Senator Brewer voting for legislation. Hal Swain and Alan Snyder. Senator Brewer just joined us. Please give him a hand. Hal Swain and Alan Snyder, Massachusetts Prostate Cancer Coalition. Sanford James, ASTU International and MOCA, Men of Color Health Awareness. Kevin Johnson traveled all the way from DC. Kevin is one of the key leaders at the Zero, the project to end prostate cancer. Tom Farrington, FAN, a crusader and founder of Prostate Health Education Network, who carries the cause of prostate cancer crisis in African American men. Anahita Padru-Hersh, Director of Operation at AdMeTech Foundation, who is right there and probably is taking care of all kinds of things for this event. This is the small group of people who made it possible for us to establish and expand Prostate Cancer Awareness Day at the State House. This is the small group of individuals who are making it possible step by step to transform prostate cancer cause into a national movement. This is a group of individuals who fought for and supported Senator John Kerry when he introduced legislation which recognized prostate cancer as a healthcare crisis among African American men and called on federal government to support imaging and biomarkers to advance early detection. Yesterday, something very special happened, and actually not every speaker on our program knows about it. Senator Boxer and Representative Cummings, long-time champions of prostate cancer cause, introduced a historic $180 million Prostate Cancer Detection, Research, and Education Act to honor our event today. This act authorizes federal government to allocate $180 million for research and education for advancement of diagnostic tools for early detection, including biomarkers and imaging. This small group of people in front of you were among the first to endorse the Boxer-Cummings legislation, which offers new hope to millions of men left in a state of shock and confusion when only a few weeks ago, US Preventive Services Task Force voted and recommended against PSA screening, the only tool available today for men for early detection. We invite each and every one of you today to join us in leading the nation for support of this legislation by signing a petition to US Congress. In your programs, you have individual letters you can sign. If you're interested to sign a group petition, it is available at the registration desk. In particular, I would like to express my gratitude to State Senate President Murray, Speaker of the House DeLeo, and many other members of the State House, Boston City Council, their staff, our new partners, American Cancer Society, Massachusetts Life Sciences Center, Cancer Resource Foundation. Our sponsors made this event possible: Bayer, Dendreon, Hologic, Invivo Philips, ICAT, and Sanofi. Last but not least, I would like to thank all of you for being here today, because it is only together we will be able to take one step forward towards making prostate cancer cause as important as the AIDS and the breast cancer cause. For everyone who is daunted by this Herculean task, I would like to remind of a new book by my personal hero, Bob Samuels. Bob rose from the ghettos of Philadelphia to the height of international banking profession and ultimately became one of the founders of the advocacy movement in prostate cancer in this country. His book is called "Don't Tell Me I Can't." Senator John Kerry and Senator Scott Brown could not join us today, and they are great champions of the prostate cancer cause. However, it's a great pleasure for me to present their videotape messages to all of us present here today. Thank you for your attention.
Thank you so much for inviting me to be part of today's Prostate Cancer Awareness Day. I'm really pleased to be with you, even if it's electronically. I wish I could be with you in person because, as I think many of you know, this is a personal cause for me. This disease took my father's life, but I was very lucky to be able to beat it 10 years ago. I want everybody who suffers this disease to learn the special feeling of being cancer-free. So much is going on in Washington now, including the reintroduction of legislation to help all of us in the fight against prostate cancer, that it was just impossible to get away, and I hope you understand that. But I know you've got my good friends, President Terry Murray and Speaker of the House Bobby DeLeo there with you, and I thank them particularly for joining the fight against this disease and being so instrumental in making Massachusetts a model of national leadership in recognizing prostate cancer as a public health priority. I also want to thank the Massachusetts legislature, the Boston City Council, the American Cancer Society, and the AdMeTech Foundation for all playing an important role in this event, and especially in helping to increase public education about prostate cancer with their Where Is Our Mammogram program. A special thank you also to the AdMeTech folks for organizing this event. Through federal funding, they've been able to lead, design, and support groundbreaking research in advanced imaging for prostate cancer. This is a great example of federal research dollars at work that will improve early detection while also reducing unnecessary procedures. One of the things that I'm working on here in Washington is reintroducing the PRIME Act with Senator Boxer. This legislation is going to help us develop new advanced imaging technologies in order to detect and diagnose prostate cancer. It'll also finance support awareness programs with a focus on men at the highest risk, particularly African American men and those with a family history of prostate cancer. Just 2 weeks ago, I introduced a resolution in the Senate to bring attention to the issue of prostate cancer, how it disproportionately affects African Americans, and the need for additional federal investment in prostate cancer research, education, and awareness. I did it because awareness and education of this disease is really half the battle. It's critical because prostate cancer is the most common cancer in men. Every year, more than 200,000 men are diagnosed with prostate cancer, including 4,000 of them in Massachusetts. And every year, more than 25,000 men sadly die from it. And 156 of those are our fellow citizens in Massachusetts. Prostate cancer is an epidemic. It kills every 16 minutes. When you catch it early, as I was lucky to do, survival rates are nearly 100%. But when this cancer is caught in the later stages, survival rates drop precipitously.